Продовжуємо робочий день. Зараз у нас щотижневий брифінг на тему епідемічної ситуації з захворюванням на грип та гострі респіраторно-вірусні інфекції. Нашими спікерами є заступник міністра охорони здоров'я України Ігор Перегінець, а також керівник Українського центру із контролю моніторингу захворювань МОЗ України Lyubov Некрасова і тимчасово виконуючий обов'язки голови Державної санітарно-епідеміологічної служби України, головного державного санітарного лікаря України Святослав Протас. Прошу, колеги.
Дякую. Добрий день, шановні колеги. Ми традиційно інформуємо про перебіг захворювань на грип і гострі респіраторні вірусні інфекції в Україні. За оперативними даними, з початку епідсезону, що почався 20...
From the season of the epidemic started from November, and as of today we have more than 1,200,000 people with diagnosis flu and respiratory diseases, and which is a bit 5% of population. Some 100,000 are around children. The biggest level of epidemic is in Kiev Oblast, where 13% of population fall ill, and the lowest level of epidemic is in Transcarpathia and Kharkiv Oblast. 4% of all the patients have diagnosis the flu. As of this week, in 19 regions of Ukraine, the level of epidemic increases the epidemic threshold 3 times. In some 5 in 4 oblasts, they increase the epidemic threshold 50%. And in 2 oblasts, the level of epidemic is decreasing. The specificity of epidemic this year is as follows: that this year we have 176 lethal cases of flu, among them 2 children and 1 pregnant woman. Among the viruses, we may split as follows: 22% of lethal cases type A, and around 2 B cases are B type of the flu, and the majority of more than 122 are H1N1 virus. The biggest number of deaths are registered in Odessa, the least number in Kiev, 11. Only 1/3 of those lethal patients, they appealed for medical service on time. Unfortunately, 2/3 addressed to the medical institutions too late. They carried out tests among those lethal cases, proved that no of that patients were vaccinated. As for vaccination, some 125,000 of patients were vaccinated, which is less than 0.3% of population, and only 21 of them were children under 17 years of age. My colleagues from the State Epidemiology Service may provide you with more detailed data. I would like to inform you about the growing epidemic of flu in Europe, the WHO organization informed about the growth of epidemic of the flu in Europe during last week's. These were 29 countries. In the past, only 2 countries, Greece and Malta, informed about epidemic. As of today, the 4 countries, Greece, Malta, Ukraine, and Finland, informed about growing epidemic. Also, in line with the WHO report, Azerbaijan, Belarus, Kazakhstan, Russia, Ukraine, Greece, and Syria informed about growing cases of difficult pneumonia in result of the flu, resulting in lethal cases. From the last week, the majority of registered respiral infections were mostly among younger people falling within 15-64 years of age. By the end of at the end of last year, during the last week of this third week of December, 5 people died. In the last week of December, 17 people died. Then 18, then 48 people, then 59, and this week 27 people died. Thus, we see that the second and third weeks of this year witnessed the biggest number of lethal cases. If we look at the split among the regions of Ukraine as of today, only Luhansk, Transcarpathia, and Ivano-Frankivsk Oblast did not report about lethal cases. All the other regions of Ukraine reported about lethal cases in result of the flu and pneumonia. About those who address to the medical institutions, those who come on the third day, 36%, almost 40% of people come to medical institutions only 6th day. And the majority of patients who die because of late addresses and have chronic diseases like cardiovascular, like kidney chronic diseases, like obesity and others, and some 71 unknown pathologies. The gender split is 106 men and 70 women, and the majority of them are younger people without chronic diseases, but they were infected with the flu virus and died quickly, which again proves that you should pay attention to your health when you fall ill at the first symptoms of the illness. Good afternoon, dear representatives of mass media. You've heard that the epidemic peak continues. The number of oblasts where the epidemic threshold is past had not changed, but the dynamics is changing. in Donetsk, Rivne, Luhansk Oblast, we observe the decline in the speed of flu spread. Those oblasts which at the beginning of epidemic had low figures of outbreak of illnesses, they now demonstrate the growth in flu patients, and this again shows that there are no borders for the virus. Today, nevertheless, we observe a clear decline in epidemic among children, and the amount of people who appeal for assistance in the healthcare institutions is gradually dropping. While 2 weeks ago there were some 70 to 90 people, the last week there were between 20 and 30 requests to the medical institutions because of the flu. This shows that the epidemic is changing its dynamic. As for the educational institutions, we observe also positive dynamics there. At the beginning of epidemic, we observed the big non-attendance in 14,000 of educational institutions, and now some 4,000 have renewed their work. Of course, they are prevention measures are now giving their positive results. In some 10 regions, local authorities allocated a sufficient amount of money for prevention measures. Just in Kiev, the municipal authority allocated 20 million of million hryvnia to raise temperature in the premises to prevention measures. Then in some other regions, local authorities allocated different amounts of money between some hundred of thousands up to 3 million of hryvnia in big oblasts like Odessa, Kirovohrad, Kherson. We keep informing people that the situation is difficult, and committees on emergency situations in different oblasts make decisions to allocate money for prevention and for prevention measures and to take measures to counteract the epidemic. Do you wish to comment? No, I am ready to answer your questions. Katerina Smetana, UA. You mentioned that money were allocated for Kiev, etc. Why it is so? Why the money allocated so late, and what you have done for this money? Purchased medicines or so many? This was not the ministry who allocated the money. These were local authorities who allocated the money on the 4th week after announcement of the epidemic by the ministry. That is, we should keep in mind that each region has different pace of the epidemic development, a different situation with the risk groups. That's why each region is able to decide itself. The Kiev has the highest level of epidemic. That's why Kiev needs more money for individual protection measures and for coping with the situation. Currently, we negotiate with a company who is ready to allocate 20,000 doses of vaccines. Have you analyzed what is the amount of losses incurred by the epidemic? I'm pleased very much with your high opinion about the Ministry of Health, but we will be able to do this when the epidemic will finish. We expect that, like in other regions where the epidemic is declining, the specificity of epidemics because of H1N1 virus is that they outbreak quickly and then decline quickly. What the Ministry of Health what measures you will apply in schools in order to prevent the further epidemic? The Ministry of Health 3 weeks ago had recognized that there was an epidemic of flu in Ukraine and recommended to take some counter-epidemic measures, and the responsibility for all those counter-epidemic and limiting measures should be taken by local authorities. As for the ministry, we provide all necessary information to the local authorities. As of today, more than 10,000 of kindergartens and schools are closed, while 4,000 have opened their operation. I have several specifying questions. What is the difference between the emergency? What does the emergency situation mean? Quite often, the statements which are made by local authorities, they do not fully reflect the situation in the region. They may announce emergency status in the region or emergency situation in the region. Probably they wish to mobilize people, to mobilize resources, to mobilize medical. Who has to announce emergency status? The emergency status cannot be allowed by the regional authorities. It should be announced by the Cabinet of Ministers or international organizations which decide on the pandemics, etc. As of today, we cannot say that there is an announcement of the emergency status in some separate region. And one more question. In some separate region, they announced the emergency situation. What does it mean? Not to go outdoors or to to stay at home. What does it mean? The region cannot introduce the emergency status separately, not at the national level. We should raise the awareness of population, and that's why they announce emergency status instead of emergency situation. Probably your colleagues can say something about this emergency state.
The matter is concerning the infectious diseases. You know that emergency situation can be defined at the level of the Cabinet of Ministers, as Yuri Bogdanovich told us, and according to the identifiers that are qualified by the World Health Organization. And these indicators are powerful, and I think that thank God we didn't have such condition during tens of years, and as Ebola in Africa, they didn't declare emergency situation in the country because this is a military, it's like a military status of the country. Mashallah. ICTV facts. I would like to ask you about the number of lethal cases. I understood that the number of lethal cases decreased, and maybe the flu virus declines. And also they announced the second wave of flu epidemic. And what is this type of the flu? And about safety of medical staff, do they have enough means for this? And whether funds were allocated for this? What is the procedure of their work in these conditions, and especially those who work in ambulances and family doctors? Thank you. First, whether we believe that the epidemic is in decline. We believe so, but the number of lethal cases is also we have information for the public provided, and all the network starting from the first level, that is the hospitals, they have appropriate number of places. People can be hospitalized if need be, and we heard that 4% of all people who fell ill were hospitalized, and 1/3 of all who died, they didn't address the hospital timely, and we should work in order to decrease lethal cases. As to doctors, we should state that the doctors are the least protected from the disease because they face those who are infected, and the decisions of local government that took the situation seriously as epidemic, and they allocated resources for this, and they treated people and medical staff, and also there were some preventive measures. They do not require much funds, and also they closed institutions for quarantine. And what are the measures? What are they? Do local governments allocate those funds, or the ministry should provide these measures? What is the technical component of this? And what is the attitude of doctors towards this? You are right. As to the provision by the institutions, they are state institutions, and local government provide this for them, and the Ministry of Health in this case has the function of redirection of the funds to the regions that are used in the institutions, and through the decentralized bodies of local government, through the banking institutions, they have more money in local governments, and they can finance these activities, and we stimulate it from our level, and in every institution, every governmental body that work locally. They know this information according to their own data, and they do all possible to protect doctors and local population. And vaccination against flu is not obligatory. It is not part of the calendar of vaccination. That's why this the procurement of the vaccine is carried out by institutions and by the ministry in order to help the workers. And the issue of protection of the medical personnel, these cases should be studied, and they were not studied properly in previous years. And what about chief doctors that are that had these institutions? Who should control whether those doctors protect their health? We have mechanisms of addressing the chief doctors of the hospitals, and this is done also in the regional departments. They know this information, and chief doctors, they provide measures for the protection of the doctors, and the ministry and departments inform the people on this, and whether this mechanism will work is the responsibility of local government. The second was about the second wave of the disease. During the last 15 years, I won't tell you about previous years, but in Ukraine there's a second wave of flu that starts at about on the 7th, or starting from 6th week from the start of the year, and this wave is caused by other type of virus, is virus B. And as I told you before, H1N1 virus, it causes pandemic situation, and virus type A causes illnesses that can circulate among people, and some outbreaks, small outbreaks. But B-type, it causes a cluster illness, and mainly they cause an increase and then a fall, and they do not, there's no lethal cases due to this virus. And if you look at this bulletin, you may see that there is a second wave that during the last 5 years appeared, and it was started in 2011, and we have some peculiarities in this process, so we'll look and see what will happen. What will be the time period? In infectious diseases, we can't say about whether it's going to be. It starts from 7 weeks, so at the end of February and start of March. So maybe there were some millions of hryvnias that were provided, and you took part in this signing these documents. And what is your participation in this process? And I heard that Alexander Pavlenko also took part in this, and there were some documents that were signed by you. Thank you for your question. These were my functional responsibilities as I had at the Department of Finance, and the document that was submitted for signature by the Financial Department in accordance with the law. It was provided to the Ministry of Finance in order to introduce some changes in the budget, in order to on the case of some debt to the ministry. And we had the resources, and according to the law, we had the resources, and we were able to repay this debt. So you knew that you had some additional money, and that's why you did this. I can't say. We have a state enterprise. It's not a person. I want to answer this question. it was an accountant procedure, and the Ministry of Finance said that there shouldn't be any changes, and that's why my function was completed in this way. And my colleagues that are responsible for this question, and I can't comment and say because this is their responsibility. So I cannot be responsible for those colleagues of mine. These are their responsibilities, and my functional responsibility. I made a request and it was rejected, and that was the end of story. And further events, this is not my functional responsibility. And it's not a case of being for something or against. According to current legislation, the request was for the Ministry of Finance, and it rejected it according to the legislation. And that's why this payment or non-payment, this responsibility was cancelled, because then there was process of transfer of funds, and this was not my responsibility. Was outside my responsibility, and those debts. This is the question of the state enterprise and their responsibility, and this is not the case of the accounting department of the Ministry of Health. So maybe this question should be posed out of the record. So if you have the wish to ask this, please do this individually. And we are speaking about the flu, so you should follow the information on the site of Ukrainian Crisis Media Center. And due to the sanitary station, we update statistics, and in the evening it is available according to the previous day results. So follow the information in order to not to have some grounds for panic. Thank you very much, and the next briefing will be in several minutes.